Today is going to be a very important video if you are somebody with hearing loss and want to work in healthcare, or you already work in healthcare and want to use a stethoscope. We have the hearing aids with Bluetooth, we have the stethoscope, we have a phone, and we're ready to go to listen to lung sounds. Wait! Okay, yes, watch this video here for 5 tips before buying a stethoscope. And by the way, I am going to be filming a video for the core digital stethoscope for lung sounds. Go ahead and subscribe, hit the bell notification so you know about that video coming up. Let's get to this. I'm going to be covering 5 general areas in regards to going back in time before hearing treatment. First topic we're going to be talking about is going back in time when we found out we had hearing loss. And number 2, we're going to be talking about frequencies and decibels, but mainly frequencies, and I'm going to share an article that's going to help us guide in that discussion. Number 3, hearing treatment and the consequences of not getting hearing treatment. Number 4, what does this all mean for us? Number 5, I'm going to be talking about the stethoscopes I use and why. And yes, I will have a bonus at the end of the video, so please stay tuned to the very end to watch that. Topic number 1, going back in time when you first developed your hearing loss and you first found out. So what now? We have to go to the professionals. We go to either an audiologist and or an otolaryngologist, and they will perform an assessment, a physical exam of the ear itself, and they'll come up with a diagnosis, a plan of care, as well as a treatment plan. I am going to be honest, some professionals are not very good at explaining how they come up with the diagnosis or how they came up with the diagnosis and why they came up with the recommendations that they did. So many of us are going to have to do a little bit of research on our own and understand our own hearing loss ourselves. Firsthand, I know that. And then what's hearing treatment? Now, hearing treatment could mean getting hearing aids for 1 or 2 hearing aids, or you get a cochlear for 1 or 2 sides, or you get medical treatment treated like surgery, etc. Now, you need to get all of that out of the way before you start to use assistive listening devices, which kind of adds to your hearing aids, and one of them is the stethoscope. All right, get the disclaimer out of the way. I'm not an audiologist or an otolaryngologist, that's an ENT doctor. I am, however, somebody with lived experience with severe to profound bilateral neurosensory hearing loss. And I do work in the healthcare, work as a medical provider, and I also provide support as a peer mentor for medical professionals with hearing loss. Welcome to Healthy Hearing Loss. My name is Dee Dee. Lived experience, what is that? I'm going to put this on the screen, and it is this: personal knowledge about the world gained through direct, first-hand involvement in everyday events rather than through representation constructed by other people. People who do not have hearing loss will not understand what we go through with our own hearing loss. But with lived experience, and if we connect with other people with lived experience, yeah, we can understand each other. Number 2, we're going to be talking about the frequency. I'm going to share this article with you from AMPHL, which is the Association of Medical Professionals with Hearing Loss. And I'm going to link it in the description box below as well. But this is the article here. What I want to do is provide a succinct description of what Dr. Samuel Atkinson wrote in his article, and sort of an animation type of graphic here. You'll see it soon. And as we go through this animation, I want you to see that this long line going across is the normal hearing, and it goes from 20 hertz to all the way up to 20,000 hertz and everything in between. You'll see on the dark side on the left and the right, that's an area that is poor sensitivity to sound. The best hearing sensitivity is going to be in the middle. Then we'll look at audiology testing, which would be graphed on an audiogram. Looks very similar to this. And you'll still see the frequencies up atop above it. It goes from 250 to 8,000. On the left side, you'll see the decibels going from top to bottom. The top is actually the soft sounds, and the bottom part is the loud sounds. Then when we get to speech, this is sort of the area. It's like a banana-looking shape here. That is going to be the speech that we would recognize, vowels and consonants. And then you'll find noise above and below within the environment. And then at the 1,000 hertz to the left is where you're going to hear bodily sounds by auscultation. And then right at like 200 and less, you'll see this range of uncertainty. That's an area that cannot be tested by the audiologist, and it's an area that we're not sure with as far as hearing with the stethoscope itself. So that's basically what he had covered in his article. And I know I went over it really quick, but go ahead and go back and watch it a few times so you kind of get an idea of what he is saying. You can look at this and also read it and see if there's some other interpretation that you're finding from it. And let me know in the comments below if you do. Number 3, hearing treatment. If we do not get hearing treatment, it can develop some issues, right? There are risks for, becoming very frustrated, which would lead to anxiety maybe, or even depression. Causes a lot of stress and cognitive fatigue, even isolation or self-doubt, as well as dementia. Now, some of these I've experienced myself. I'm sure you've experienced it yourself, even with hearing treatment. But imagine if you didn't have hearing treatment, how bad that would actually be. Having my hearing aids and not being able to hear as good as I possibly can has caused me to have a lot of anxiety and depression. It's not fun. You need to have good hearing treatment. And I'll also link some articles in the description below if you want to take a look at that. Otherwise, you can look on Google and find some articles yourself. If you find anything that's really good, share. Number 4, what does this all mean to us? You and I are the experts of our own hearing loss. Not even the professionals know our hearing loss as well as we do. So we are the experts. Professionals have training, and they are trained to test and recommend and do a lot of work with us, but they do not know how we actually hear. So finding a really good audiologist is super important. In fact, I've had several audiologists my whole life because I've been hard of hearing for, over 50 years. Some were not so good. Some were, not too bad. And then some were excellent. So, and the reason I talk about that is because having a good audiologist, they will honor the patient-centered care, which means that they will work with you to come up with a plan of care and treatment. They don't tell you what you need to do. They work with you, and they follow best practices. And I'm not going to talk about those here in this video. You can actually go on Dr. Cliff AUD. He's an audiologist, a doctor of audiology, and his YouTube channel is down below in the description, and he talks a lot about best practices. I didn't even know what best practices was until I watched his video, so I highly suggest you go check it out. So the next thing we're going to talk about is advocate. Advocate for yourself. You have to do it. If you can't hear something, you need to go back and tell somebody. If you are not hearing something at a meeting, you have to advocate for yourself. Get closed captioning. Make sure you can see people. People with hearing loss do not have the same hearing every day, and that is because either something in the environment might be interrupting the hearing, or maybe you have fluctuations due to a cold. Some of us have tinnitus or tinnitus, or people do not understand how to communicate with you because you have hearing loss. You have to advocate for yourself. People do not know that you have hearing loss. It's an invisible condition, and people do not know unless you have your hearing aids like, colorful and bright, and you just show it off everywhere you go. Next thing is audiological training or rehab. We need to do things to help us hear better. Every time I get a new hearing aid, it's like learning a new language. Seriously, it's different. I have to train my ears to understand the sounds around me. I have to adapt, and sometimes I have to learn or know when to get away from sound so I can let my ears rest. It's like you got to train your ears to fit your hearing level as well as your mental state. So training your ears to listen in different environment, go to different environments and just listen, whether it's going outside and listening to the birds or the trees or the cars, that type of thing. Practicing how to pronounce something, like this would be an opportunity for me to pronounce something, go back, listen to it and really listen to see if I'm pronouncing right. I know I don't pronounce things all the time correctly, but I'm okay with that because I'll get better down the way. Visual cues are super important. You need to see somebody, look at their facial expressions, their body movement. My assistant Jackie, no expressions, no body movement. I can't understand her half the time. Plus she's wearing PPE all the time, and trying to listen to her through the mask, it's ridiculous. It's the hardest thing that we have to go through as people with hearing loss with all the masks in the hospitals and the clinics, right? Frustrating, but we have to do the best we can. And we may just need to keep adding stuff to our hearing aids. Buy more stuff, it's so expensive. Read as much as you can about hearing loss, research it, talk to your audiologist. We need to understand how we can make our hearing better all the time. And visual cues are really important, like not only just visual cues on a person, but also like in a video. If you want to learn a certain topic, go watch a video that talks about it, that has animations, that type of thing. Last one, number 5, what stethoscopes do I use and why? I use the Core digital stethoscope, and this one I really like because I can connect it to the Echo app on my phone, and not only can I listen to it, I can see it visually with the waveform and feel better that I know that they're mapping up and in sync, and that what I'm hearing is really what I'm hearing. You know what I mean? So I use the Core digital stethoscope most of the time in the clinic and even outside when I do street medicine, and I like it a lot. I'm still working on different sounds to make sure I understand sound. Yeah, this is my primary stethoscope that I use. I also use the ThinkLab stethoscope, and that one I use a lot of the times outside in the street because it has such a high amplification. It goes up to 100 times, and I can hear just about anything in any setting, whether it's by the river, by the street, in the woods with the wind, all that stuff. So I love the ThinkLab stethoscope outside in the field. I do have my ThinkLab stethoscope as a backup. In my playlist for medical professional with hearing loss, there's different stethoscopes in there and the way to use it as a setup, whether it's with Bluetooth, streaming through your decoil, that type of stuff. So go ahead and watch those if you want. Bonus. Yes, last topic. Bonus, we're going to talk about the Core stethoscope with PPE, personal protective equipment. Okay, so here we go. We have the tie for my hair around my wrist. We also have the stethoscope around my neck. Here we have our N95 surgical mask, a glove, goggles, which are right on my hip right over here. And then I have my phone that's in my pocket. The first thing I want to show you is how to make it a little safer with the Core stethoscope. I'm going to take this off. I'm going to go ahead and disconnect this part, so I no longer have the earpiece. I have an elastic band around the head of my stethoscope. I'm going to take that off. There we go. I'm going to put my head of my stethoscope in the glove. What I want to do is find a smooth spot on the glove so that it's flat against the diaphragm, because that's what I'm going to use. It's mostly the diaphragm. And if I can get lucky, I can also do the bell of the head as well. So I just kind of crunch it up until it is pretty flat on all edges. And then I take the elastic band and I wrap it around a few times first, and then I'll go ahead and smoothen it out as best I can so it's nice and flat like that. And then I'll also do the same thing on the other side. And as soon as I can get it to be good, I'll just start wrapping it around the whole stethoscope head until I have a pretty smooth area to listen to sounds. And as you can see, that's pretty good. That's pretty good. And then this way I know the head is not going to touch the patient, and it will be easier to keep it cleaner. And then I have that with my phone in my scrub pocket. I'm ready to go. Now we can go ahead and get ready for full PPE. Again, I'm going to tie my hair back, get it around my ears, get it nice and tight, get as much of my hair out of the way as possible. And once I get that tied up, then I can go ahead and put on my N95. So much fun. There we go. Make sure that my hair is nice and tucked away. Then I go ahead and grab my surgical mask. So as you can see, I have my hearing aid there. I try to keep it exposed away from everything so that the microphone doesn't get hit by all the stuff. So there we go. I got that ready to go. You can't hear me in this thing. See the difference? Let's try to. Can you hear me okay? Can you hear me okay? Ridiculous. Then I have my goggles. Slip it on the outside of the ties. So there you go. Now I can go ahead and use the stethoscope without the tubing. If I wanted to, I could use a full plastic thing, bag or something, and put it around the whole stethoscope and hide the whole stethoscope. I would take my phone and I would open up the Echo app, and it's looking for me to connect. So I'm going to go ahead and turn on the Core stethoscope. to the flashing light, connect, and I can hear. So there we go. I'm ready to PPE, phone, core stethoscope protected. This is the way I do it in the clinic. I try to keep the phone on the counter or on a table, and I'll clean this after I'm finished. I'll take the glove off of this and change it to the next patient. There you go. What do you think? Okay, let's turn this off. Ready to roll. There's some dogs barking in the background, so I think this is going to be the end of the video. If you like it, thumbs up. If you dislike it, tell me why in the comments, and let me know what I can cover if you're curious about anything about any of the stethoscopes out there that we can use with hearing loss. Thanks for showing up today. I appreciate it, and I'll see you in the next one. Take care. Bye.